Our next speaker is another pioneer of Ayurveda, Maharishi Ayurveda in the West. We've been colleagues for probably 30 years. Dr. Donn Brennan is based in Dublin, Ireland, and he's sometimes known as the leprechaun of Maharishi Ayurveda, sorry to say. He is the founding president of the Ayurveda Practitioners Association in the United Kingdom, and he is the medical director of the Maharishi Ayurveda Health Center in Skelmersdale, UK, and he'll be speaking to us on Maharishi Ayurveda and patient-centered care. Please welcome Dr. Donn Brennan.
Jai Gurudev. First of all, I learned something new there. I didn't know I was known as that. What I'd like first of all to say is thank you all for being here and for the wonderful power of your settled awareness onto the field of perfect health. Because just in being here, you're enlivening all those laws of nature which traditionally were called Dhanvantari for the sake of perfect health individually and collectively. So thank you first of all for that. And thank you also because we learned this morning that to be in the presence of the enlightened is very good for my mental health. So I thank you for that as well. What I wished to discuss was the, once again, amazing contribution of Maharishi ahead of his time to fulfill a new phenomena which has become lively within the health field, which is patient-centered care. I wanted to make a point about the power of patient-centered care. And you may know that Ireland underwent a catastrophic existential economic crisis. If we do things in Ireland, we sometimes do them very well. It's a textbook case of probably one of the most dramatic collapses of an economy. But in the middle of that horrendous crisis, the government of Ireland were persuaded by the parents of children to spend €500 million on developing a new children's hospital. It just strikes me as that patient-centered care has an amazing potential. If we were to define patient-centered care, the Berwick report is a fundamental report in this area, and it just says that patients and their carers should be present and powerful at all levels of healthcare organization, from the wards to the boards. So that's in terms of health services, whereas another scientific piece talks about patients known as persons in context of their own social worlds, that they're listened to, they're informed, they're respected, they're involved in their care, and their wishes are honored in their healthcare journey. So basically, it's putting the patient at the whole center, which is a bit surprising that this is just coming up at this time. But as the patients might say, nothing about me without me. It actually is now recognized as a new paradigm. The old paradigm was medical paternalism, where the physician instructs the patients about what they're to do, and the patient often follows the physician's instructions. In fact, where we went from a very caring family physician who listened, examined, and advised, it's become increasingly technical, where the doctor's role even is changing and becoming even more remote from the human context of the patient-doctor interaction. The doctor may rely for diagnosis on an MRI scan, so even the process of diagnosing is moving into technology. And some of the treatments that the doctor will get involved in are very technological. And when it comes to how the doctor will treat any disease, now there's been developed protocols. So the doctor must follow the protocol. In fact, he may be disciplined if he doesn't, because to follow best practice, he must follow this. So in other words, the doctor is actually now in a role of a technician more, applying protocols. And that very human relationship is getting lost to some extent. And so it's not surprising that there's a swing back now towards patient-centered care. So this can be a challenge to some doctors as well. But most would be embracing this concept and see it as, obvious now. Many leading organizations, the King's Fund in the UK, the World Health Organization, the Picker Institute was interesting because really the whole phenomena started in about 1993 when research from their institute started the whole discussion in the scientific literature. And they had 8 dimensions of patient care where the patient's preferences and values were to be respected. The patient was to be emotionally supported and physically comforted. Information, communication, education should be a feature of the relationship with patients. Family should be involved. There should be very careful observation of continuity of care or transition of care from one area of the health services to another. And the care should be coordinated and access to care. Subsequent reports bring out the same points. But I like designing care processes to suit patients' needs, not providers, the third from the bottom. Because some people are even suggesting that now what should happen is that appointments or even surgery should be organized according to the patient and not to the doctor's needs. And one suggestion has gone so far as to say that the medical notes, which up to recent times were very hard for the patient to get access to, their own notes about their own most personal health issues. Those notes should no longer be in the control of the doctors. They should be in the control of the patients, and the patient should invite the doctor to look at their notes. Now, I think for many that's going to be a step too far, but it just shows the conflict in the paradigms. So basically the patient's at the center, everything, the health services, the health personnel, the research, the politics should all now be motivated towards the patient's needs. And of course, ethically, philosophically, anybody would say that that should always have been the way on moral grounds, but now the evidence is accumulating that patients, families, and health care providers working together, the health care's quality rises, the safety improves, the costs decrease, and the satisfaction for everybody all around increases. There's even now questionnaires that practitioners can use to actually access information about their own patient-centered care. By giving the patient these questionnaires to fill out, they can judge themselves. And the interesting thing is that, though it didn't come out very well on projection, I would imagine that Maharishi Ayurveda practitioners will score in the top, absolutely, in all of those factors. And we can see why. The only thing I can think to do to give you an experience or a recognition of what Maharishi has given us in relation to patient-centered care is probably to describe, to some extent, my own practice. And every practitioner will be absolutely unique. It's the beauty about Maharishi's knowledge. Everyone is unique. The relationships they have are unique. So obviously what I do is not what everybody does. And I have sat, though, with, thanks to Maharishi and his organization, with the most incredible voyages whose very presence I have witnessed to heal. And that's the ultimate. So in my practice, someone comes in and I like to orientate them at some point and ask how much they know about Ayurveda and then how much they know about Maharishi Ayurveda, and to point out to them that consciousness, that aspect of their own innate silent wakefulness, is what conceives and constructs and governs and becomes their body. And so, from that point of view, they must recognize that Ayurveda is innate within them. And so everything in the consultation comes back to Maharishi's definition, one of his many definitions of consciousness, that consciousness is a self-referral field. We know that we have this immense tripod of consciousness, mind, and body, but from our perspective, consciousness is mind and is body. And we know that through the senses, the 5 elements emerge, and from there, Vata, Pitta, and Kapha. And we have this wonderful concept of consciousness, mind, body, environment that you've seen earlier in the weekend. And I've underlined 3, the emotions, the intellect, and the mind, because the senses in the body and our relationship with the environment are going to be covered by balancing Vata, Pitta, and Kapha. And so you can see in a consultation how that might work. The ego is so profound, our own concept of ourselves, that obviously it's going to take us a long time to resolve that little self so that we actually rise to being that field of consciousness which is unbounded being awareness, the big self. But for the Ayurvedic doctor going into a consultation, he recognizes through Maharishi's knowledge that he's entering a sacred space. And insofar as he possibly can, his little self has to remain outside the door. And he becomes a silent witness to the unfolding field of life, which is his patient. And it is quite a sacred space because the divine is manifesting this being. And so he does his darshan, sparshan, prashna, he looks, he takes the pulse, he does the history. In so doing, he's drawing out from the patient all their concerns, but he's formulating them in his own mind in relation to Vata, Pitta, Kapha. And now there comes a point when he can start to bring this self-referral value to the patient. In relation to the mind, he can go with them in their history, and often there's an event or there's a whole sequence of events wherein they initially got significantly out of balance. Maybe it was for a lady, the birth of a child, or maybe it was a very great grief. And you can actually point out how at this point perhaps the patient Vata has gone out of balance and they started to feel it manifesting in terms of maybe disturbed digestion or whatever. And as the years have passed, how this Vata imbalance has become more significant and involved more organs and tissues and caused more problems. And so you're explaining to the patient something that the patient intuited already, but now you're giving them a very simple knowledge, a very simple explanation that they can relate to. They know you're right. They've been to the doctor, they've asked, how did this happen? The doctor said, well, your blood pressure, it happens. And Ayurveda is saying, no, all these events in your life conspired to cause you to go out of balance. And then coming into the present, it's very easy. You ask the patient about their daily routine and their lifestyle. And you start to bring out from them the reality of how much they know. You ask them, what time do they go to bed? And they say, well, I go to bed about 12:30, 1 o'clock. And you ask them, do you think that's wise? And that surprises them. And there's a long silence. And then they laugh and they say, no. So then you ask them, what do you do for lunch? I go out down the road, get a sandwich, come back and eat it as I attend the shop. And then you ask them, do you think this might be related to why you feel bloated stomach and heartburn? And again, they're looking at you and they're saying, And what you're doing is you're bringing out from them the knowingness that is within them, even on the level of their mind, but they're so distracted by life and so out there. And so you then start to give them the reality that they know what they need. If it's a Vata person, you're saying, how would you like to go to bed early tonight? And say, oh God, I'd love it. And you say, do you know what? Next weekend now, you should wake up and think to yourself, I've absolutely nothing to do today. And they say, oh. And then you ask them, would you like a massage? They say, yeah, I love massage. And then you're telling them, listen, this is exactly what you need. You know what you need. You haven't been listening to yourself, that's all. And suddenly they start to relax because they can start to see in their own mind how actually what they already knew is what they need to actually do. And that's one thing. Knowing it is one thing. Getting to do it is the next. Which takes you to another level, the intellect, which is the discriminating faculty. And what you're actually doing now is perhaps someone has come in with blood pressure, cholesterol, and been to their GP, and the GP has done all the tests, and then he consults an app and tells them that, according to the app on the phone, what with their family history and their stress levels and their cholesterol and their blood pressure, they have 10% chance of dying of a heart attack in the next 10 years. So therefore, take the tablets, anti-blood pressure, the cholesterol. And I mean, they come with that mindset of fear and disease. And now you're sort of showing them how, from their own common sense, they can make changes in their life that they know is going to make a difference, except you as a professional are telling them this is making an awful lot more difference than you realize. You've got to do it. So the next thing is just to motivate them and to get their intellect completely committed to the changes that you have to make, that they have to make. And you negotiate that with them. What are they prepared to do? Because even if you get them started, you know that the very beginnings of integration and balance in their mind-body will start to get them thinking more clearly, and the next time you can get them to do more. But it's very interesting as well that you're also working on the level of feeling, of their emotion. Because, and most often I'd see this now with a middle-aged lady. And you just say something very simple like, you know, you have to learn to love yourself. And then there's a profound silence, because you have to let that sink in. And often there are tears as that's processed. Because the reality for them has been all their life. They've been devoted to their children, devoted to their husband, and perhaps working as well. And sometimes you try and lighten the mood, and you ask them, you know, how they think of that, and then you point out to them, you know, that they wouldn't do that to their children. You know, that if the children were tired, they say, go to bed. If the children were hungry, wouldn't you feed them? And then I sometimes say, you know, if you did to anybody else, if you did to your children what you do to your own body, you'd have yourself up for abuse. You have to judge who has a sense of humor and who can run with it. But you also have to be careful, because you have very ill patients, people with cancer, and you can't have them going out the door saying, oh my God, I did this willfully, I ate wrong, I had a bad routine, oh, look what I've done to myself. So you have to then bring back the holistic context of pointing out how we are all in this society, in this collective, and our whole orientation up to this point had been to look out, and we lost touch with that innate being and awareness. So you're bringing to their awareness that whole pragyaparad and the need for them to reconnect at a very profound level with that innate being who is structuring their physiology, and begin to recognize. They came in the door. Often I will say before I start, you know everything I'm going to tell you. You know what you should be doing. But you have to hear me telling you before you're going to do it. And so it's a recognition, because the knowledge is already there. The Veda is in the physiology. And the whole of Maharishi's program is that self-referral process, but most profoundly with the self. And that you can bring out then to the patient in that context. So you can see how the Maharishi Ayurveda context gives the physician so much more that he can bring to the patient to awaken within the patient that amazing wisdom that they already have, and to motivate them to get back on track and get back in tune. And so there's so many other aspects of Maharishi Ayurveda that the practitioner can bring to bear according to the needs of the patient. And what is, I think, so fascinating, though, is that, again, when this concept and paradigm of putting the patient at the center and providing for that patient all the patient needs for health, we have Maharishi in his wisdom decades before bringing that whole concept to fulfillment when you get to the center of the patient through Maharishi Ayurveda, through their consciousness awakening. And that's the ultimate of patient-centered care, and that's what Maharishi Ayurveda is bringing to patient-centered care. And this is such a powerful paradigm. We can use it to our advantage, because ultimately, if patients out there knew what is here within this room, the knowledge you have this weekend, they would be so demanding of it. We've got to get this knowledge out there, because the way we're going to move the politicians and the administrators and even those healthcare practitioners who are established in old paradigms, the way we're going to get to them is through their patients. So the most fundamental thing anyone in this room could do for anybody else is awaken them to that innate being of their own consciousness and teach them TM. And the second most important thing anybody in the room could do for anybody they love, anybody they care about, anybody they know, is to give them what you know about Maharishi Ayurveda. It's a blessing to them. And as you do, you're doing the work of Dhanvantari, and you're doing the work of Maharishi. You're repaying him in very small measure for the immense wealth you've got from him. So, thank you.
Making us aware about the patient-centered care. I remember my medical teacher telling me, for best patient-centered care, give them tender, loving care. So I asked, if it doesn't work, increase the dose.